Good afternoon, everybody. It's Dr. Leah here. I wanted to get on and chat with you this week. It's been a while since I've been able to get on. This week, our social media is talking about milestones within baby, and then by the end of the week, we're going to be getting into colic. So things we're going to be talking about today is going to be milestones from birth to 24 months. We're going to be talking about how the sequence really matters more than the timing of those developmental milestones, and to help you understand when it's time to trust that mom gut of yours, and seek help beyond maybe some of the advice that you've gotten either from your medical provider or maybe from friends and family that have just said, wait it out, it will get better, but in your mom gut, that just feels icky. So we are going to start with the different milestone classifications. And so milestones are divided into age ranges. So we have 0 to 12 weeks, 3 to 6 months, 6 to 9 months, 9 to 12 months, 12 to 18 months, and then 18 to 24 months. We're going to go through each of these different age ranges and what kind of we expect in these age ranges. So first is going to be that 0 to 12 weeks. That's what we call the foundation. So these are going to be things like those rooting reflexes, sucking reflexes, grasping. When you put your finger in your child's hand, they should grasp that. That's a reflex. Those moral reflexes where they have those big startle reflexes when you go to put them down. As far as head control, we should start seeing that they should be trying to lift their head. They should be able to turn their head from side to side, and they should be trying to lift their head up when they're on their belly. We don't want them to lift it up with too much control. We don't want them to be stiff and holding their head up and looking side to side. We want them kind of bobbing. They're getting that muscle function. They're getting that muscle strength. If they're holding their head up right from birth, they're doing that more with the tension throughout their system and less with the muscles. As far as we can move into vision, so by the time they are starting to get to that 8, 9, 10, 12 weeks, we want them to be focusing on objects within 8 to 12 inches and tracking objects moving. As we move to 3 to 6 months, this is going to be strengthening and coordination. So we start to see those social smiles, smiling in response to interactions. We also start seeing them start to roll from tummy to back, and eventually from back to tummy. They start grasping objects. They start holding and shaking on to toys, and they start cooing, gurgling. All of those cute babbling sounds start to happen during this 3 to 6 month time period. And we move on to 6 to 9 months. This is where we start to see more mobility and exploration. They should be exploring their world. So we want to start seeing them sitting without support, moving around on their hands and knees. Maybe they're doing a little bit of rocking on their hands and knees. We also want them to start learning about object permanence. So understand that objects exist even when they're out of sight. So, for instance, if mom is in the same room as them and leaves to go into the kitchen, they know that mom still exists even when she's in the kitchen and she's not in the same room as them. They might not like it, but at least they know that it's happening. They also should start responding and recognizing to their own name at about 6 to 9 months. Then moving into 9 to 12 months, this is our independence and imitation stage. So they're going to start using furniture to pull themselves up. They're going to start walking while holding on to furniture. They're going to start saying mama, dada, and other familiar words. They're going to start using their fingers to point at objects. They might begin waving, saying bye or hi with their hands, not necessarily with their voice. That's all about independence and copying us, our imitations. Those are the ones that we're going to talk about today on this video. But we could also go into the ones at 12 to 18 months when they start walking more independently on their own, when they start running, all of those really exciting things. You can also go into the milestones with eating and how they are eating. All of those things, if they're willing to try new foods, that sort of thing is also a developmental thing. And it's interesting because actually 1 in 6 children in the United States have a developmental delay. And while every child does develop at their own pace, we want to make sure that they're not skipping steps or reaching those miles, especially the ones that we just talked about, those milestones, reaching them out of sequence, walking before crawling. If they're doing those types of things, it can indicate that there are underlying issues that may need attention. So in our practice, we see lots of parents who many times have been told, not only by their medical doctor, but many times by friends, by family, that, just wait and see. They're going to be okay. They'll grow out of it when we express concerns, because many times we're talking to our friends and our family about that because we're venting about baby's development. We may be feeling really worried about that. And as a pediatric neurological chiropractor, but also as a mom, I know that we need to make sure that we're following that gut feeling. And if there's just something in your gut that is saying, I need to seek more answers about my baby's overall well-being because I'm concerned about some of these developmental milestones that maybe are not happening quite in those steps that we're talking about, please reach out, but continue to watch this video because we're going to talk a little bit more, but please reach out to me. We'd love to be of assistance to you. So as we already talked about, the order in which babies achieve milestones is much more important than the exact timing, as this is ensuring the proper nervous system and neuromuscular development and connections. So the example that I gave before, the crawling before walking, that is essential because the cross-crawl pattern helps both sides of the brain to communicate with one another, which is going to be crucial for healthy nervous system development. Skipping these steps or reaching milestones out of sequence just can indicate, again, an underlying issue with that nervous system. Is there tension or stress being held somewhere that's causing some sort of connection from the brain to the body or from the body to the brain to get off track? Our office focuses on the health of your baby's nervous system and understanding that basics like eating, sleeping, pooping, we have to make sure that those are on track so that these other milestones can follow naturally and with more ease. We use neurological insight scannings, including neurothermal and heart rate variability scans, to help pinpoint areas where stress and tension may be impacting your baby's development. We also create customized, personalized care plans that are really, really tailored to each baby's exact developmental needs based on those scan results, ensuring a very personalized approach. It's not a one-size-fits-all solution. If while you've been listening this, you've been feeling that something just isn't quite right with your baby's development, whether it be a delay in a milestone, unusual behavior, struggles with eating, sleeping, pooping, or just being nice and content, a happy baby, it's really important, again, for you to trust that gut. Seek the hope, seek the answers, seek the help that you've been searching for. At Vive, we're here to support you and your baby and your family every step of the way. The best way to ensure that your baby's nervous system is functioning optimally is that they're hitting their milestone in the correct sequence. We can make sure that that is happening for you. These advanced assessments of those neurological scans are going to allow us to pinpoint those areas of stress and tension. It allows you to see the areas of stress and tension that your baby is holding on to and why that might be impacting the baby's development. And this also just gives us a nice, clear path forward to help support your baby's growth. So trust your instincts and take action now. Send us a message, give us a call. We would absolutely love to help your baby get started in the best way possible in that first year to 2 years. It was so great getting on here and chatting with you again. Hang in there for social media this week. Again, like I said, we have a little bit more coming about milestones, and then we're going to get into colic by the end of the week. So if you know of anyone who has a new baby, please send this over to them, or just send them either our Instagram or our Facebook so they can hop on and they can scan through and see if anything is valuable to them, so that we can help create a life of greater ease for all of our kiddos. You guys have a great rest of your Tuesday. I hope I will be back on next week chatting with you. Stay warm. It's getting kind of chilly out there with those 60 degrees, 50 degree temps. And have a great Tuesday. Bye.